Recording in progress.
Hello, everyone, and thanks for joining us for today's webinar. My name is Donna Chow, and I'm your host and your moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is Understanding Jimmy Chang's Clinically Proven Formulas, Part 2, presented by the master herbalist himself, Dr. Jimmy Chang. Before we begin, I'd like to go over a few items to familiarize you with our webinars and how they work. Today's webinar will be from 2:30 to 4:30 p.m. Pacific time, and we will have one break. Dr. Chang will let you know when we're having our break. For lecture notes, please download them directly from the Blue Course Access page in your eLotus account. And to use the webinar chat room, please set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. And you can go ahead and do this right now. By default, Zoom just has it where the chat is sent to the host, which is the eLotus staff and Dr. Chang. But we want everyone to be part of the conversation, as I mentioned. So please, again, set your preference to everyone. And to ask Dr. Chang a question, you can go ahead and enter your question into the Q&A box. And if time allows, Dr. Chang will respond to them accordingly. And finally, the quiz and the video replay, you will be notified by email tomorrow once they are available. So our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique combinations. You will learn about a range of herbs for breaking up masses, stop bleeding, and also his special formulas for skin disorders. You'll also learn the pulse indications associated with specific conditions and how to prescribe a unique herbal formula for your patient. Dr. Chang has previously taught numerous courses with us, which is now available for purchase as distant learning CEU videos. Dr. Chang is the person to learn from if you want to be able to feel your patient's pulse and be able to identify the Western medical diagnosis and come up with your clinically effective herbal formulas. If you want to cultivate your pulse diagnostic and herbal skills, he is the person to learn from. I recommend the Gold Pass for learning his pulse system. You have unlimited access for a year to his pulse courses and herbs. And with the Gold Pass, you can also try the herbs that he mentioned, since our sponsor, Evergreen Herbs, will give you a voucher for herbs. When I return to my computer, I will post the link so you can read more about it. All right, so let's get started with today's class and begin. And welcome, Dr. Jimmy Chang.
Hi, guys, it's me again, Dr. Jimmy Chan. I'm here to talk about something very interesting. Hello. Okay. Today we're gonna talk about three breakers and one lump combo, which is very, very interesting. And I'm sure it can use it exactly the same thing here starting from tomorrow morning with the all your patients will be very happy. Okay, now let's get on with it. We call this mass breaking formulas and some pulse science Actually, I'm making it a lot easier for you. Even you are not very familiar with my pulse signs, but you can see from here, you can do anything you want. Okay, let's get started, huh? Okay, see the ear signs? There's a lot of things in there to say. Let me do this for you. Okay, now you see, this is the stomach area. See the black spot there? If the patient's demand is for treating his stomach problem, you might want to use my code breaker or lump special. I mean, lump combo. See this one? This is the gallbladder. So if you want to treat, if the patient demands you to treat his the pain on the right hand side on the rib, the gallbladder area, you can use my code breaker because it's cold, it's white. And see this one? This is the thyroid area. Thyroid and it's black, it's dark. So we might use my lump combo for the thyroid part. See here, the redness in the head, that's the redness means inflammation. So if you want, if the patient demands you treat his headaches or something, then you can use the my hot breaker. And see this one? For men, this is the testicle. So if the patient's major complaint is the pain in the abdominal area, you might use my lump combo to destroy that stuff. And so is here. This is all these are the testicle area. This is above the testicle. This is on the testicle. Or if for women, this is the ovary. There's a lump above the ovary. And this is the lump of black spot. The blood stagnation is on the ovary, can be caused from previous operation or abortion or whatever in that. We can treat it with my cyst breaker or lump special, whatever. And see the darkness here, that's the hip. So if the major complaint of the patient's pain is the back pain, so we use cold breaker to deal with the darkness. But now this area is the hip. That means inflammation. So you might want to do something about it with my hot breaker. Try to remember the two words. Huh? One is for inflammation, one is not. Okay, see this one? This could be the duodenum or just stomach itself. It's red, so we use hot breaker for all the different kind of discomfort in the stomach area. Huh? Oh, this, by the way, this black spot is we call inner ear, which might cause dizziness or something. See this one? That's the knee joints. It's purple. So sometimes we use something blood movers like 生痛足鱼汤 or 正骨紫金丹 or my breakers. Hey, hold on. I'll have to go back. Oh. Okay. You see this area. See this area? That's a hemorrhoid. And it's dark. That means the blood is stuck in there. So you might use my cold breaker to destroy that, to get rid of all the symptoms. So see, a simple ear can show you so many different conditions. And we have all the herbal formula, my breakers to deal with that. So it's going to be very, very interesting today. Okay. Any questions so far? Nope. So even you are not familiar with my pulse signs, then you can just watch the ear. This is so clear. It take only 5 minutes to be able to do that. See this area? See this? There's got to be some scar caused by previous ulcer or something in the stomach. If it causes pain, then use my breaker. It will cure it right away. Okay, No questions so far? Okay, next one. Okay, we'll be talking about 3 breakers: cold breaker, hot breaker, and cyst breaker, and lump combo. And we'll be talking about psoriasis and the skin combo and stomach combo and black one, which is very useful in your daily practice. There's no doubt of it. Everybody will encounter a condition like that every day, which after today's seminar, you'll be able to deal with all those very difficult to treat problems. Trust me, it's very worthwhile. Okay, let's begin. Okay, first one is the code breaker. The name code breaker, I don't know who gave the name, me? I don't remember. But anyway, it's supposed to deal with all the cold or stagnation condition, which means there's no inflammation. So how do you know if the guy has inflammation or not? By taking the pulse. If the pulse is very jumpy, then there's got to be some inflammation in there. If the pulse is so dead, the amplitude is low and not working properly, then we'll be able to know that's the code breaker. I seems to be forgetting something. So is Tina supposed to say something before? Nothing?
She's going to ask you something.
Okay. So what a code breaker is for any mass that is cold in nature. Cold also combined with stagnation. So you can see in the previous year, all those dark spots are cold. Then in the ingredients, it's like this: 三联而足 and 王不留行. Don't use it for any possible pregnant lady. Huh? These two together, Tina asked me, why are you using it, this 三联而足? Because I told her that there's got to be some kind of a lump or swollen tissues, old trauma or injury caused by anything, not only in the bone or structure area, can be in the inner organ like the stomach, like lung, like chest, like the ovary, in the gallbladder, in the kidneys, or sometimes in the liver, and mostly in the gallbladder. Can be anywhere. Sometimes we cannot see it. We do not see it on the ears, or we do not see it on the pulse, but we still feel that I still believe there's something like that. So that's why I designed this to destroy that. And even you're not too sure about it, you can directly use it. %, this two combination for all kind of pulse, like the pulse. Okay, this is 寸关尺. The pulse, it can be, the lump can be here, can be between 寸 and 关, can be between 关 and 尺, and which is normally, I mean, is very commonly seen here and can be here. This can be left-hand side or right-hand side, all possible. So, like I said, my pulse diagnosis, the biggest my system, between my system and the very ancient pulse system, like in your textbook, is the positioning, the hand method. My 寸关尺 is not on the high bone of the wrist. Like in your textbook, they said they want you to put your middle finger on the high bone, and that is wrong. I do not know why, but I learned it from my patients. Mine is more accurate. It's the only thing that accurate. So a lot of people, when I was in Taiwan, they don't believe in pulse diagnosis because they use the pulse scale from the textbook. It didn't work. It never worked. Mine works all the time. So, like I said, when you learn my pulse science, make sure you put the finger in your right position. Use the high bone here, put between your first finger and second finger. And you will see something on the cun maybe, and something in between cun and guan. Something if the stomach is no good, you might see something in the stomach. There's a lump in there. And you can verify your pulse finding by the ear point. Ear point can be more easier and more direct. And mostly you will see a lump between guan and chi. And sometimes maybe you even see something under your third finger, the chi. So the lump can be anywhere. And as for now, let me remind you a very, very important skill of taking pulse diagnosis is that after taking the pulse with your finger bed and use your fingertips to feel the pulse, you will only find the short pulse that we call a short pulse. That means lump there from your fingertips. Otherwise, you can never find it. And as for the jump, the force of the pulse, if it jumps very strong against your fingertips, then it must be fire. If the amplitude up and down is very limited, it doesn't jump really much, then it's stagnation. Then use my different lump breaker or cold breaker, hot breaker to deal with it. Huh? Okay, any questions so far? Would you recommend that we should take cold break once in a while? Huh? Oh, sorry.
Okay, Zhang医师.
Hi.
Hi, everybody. I will be the representative to ask questions. I'll start first, so you guys can feel free to type into the Q&A. Don't be shy to ask questions. Dr. Chang is excellent at answering all our questions. Sometimes he'll call us stupid, but don't mind that, okay? Just keep asking. Dr. Chang, before we go on, can you explain first what exactly do you mean by mass? Because I think it's a little bit misleading, or maybe my understanding of, this group of herbs that you're using now, for mass, lump, cyst, is really not like what we think about, like fibroids or, cysts. It also includes, like you said, swollen tissue, right?
I didn't use the word mass, you did.
Yeah, I know. So it's probably my misunderstanding. When you want to break something, like, for example, this cold breaker, we're breaking up some sort of stagnation, some lump, some swollen tissue, some cyst, right?
Oh, yeah, all of them.
And past like trauma and scars, that's all included, correct? Or
of course.
Yes. Okay. So for example, you said swollen tissue now.
Yeah.
Does like a swollen tonsil, is that a swollen tissue that you can use? Okay. So for example, let's keep with this topic, okay, the swollen tonsils. Would you use a breaker? Or would you use the astringent complex? Last week we talked about reducing the inflammation.
We destroy that first.
Which one?
We destroy the lump first.
Destroy the lump first and then reduce the inflammation later.
Yeah.
Okay. So another question.
Or you can use them together.
Use them together. Okay. Yeah. Use them together is even better. So the idea is, everybody, that we're not really treating actually something that is, not supposed to be there, like any kind of mass. It could be, again, your existing organ that is swollen, or any kind of lump or cyst that's extra growth, and any kind of past trauma, like he was talking about on the ear. Remember just earlier on, any brown spots, all those scar tissues from past surgeries. So what you're looking for is pretty much on the pulse, you're looking for a convex, like bulging pulse. And if that pulse is forceful, then you know that there's heat along with the whatever that is, this mass, let's call it. And then you would use the hot breaker because it's a hot condition. But if it's like a lump, but then there's not much pulse to it, not much strength to it, you use the cold breaker, this one that he's talking about. And if you cannot figure that out on the pulse, you can just go to the ear, right? Dr. Chang was showing us the ear just earlier on, that little white spot on the ear, that's a cold mass because it's white. But if it looks red, then okay, then, you're dealing with a red lump. I mean, an inflamed lump, something swollen. And if it's brown, then, I guess it could be either hot or cold, right? If it's brown, Dr. Chang, most likely cold.
Yeah.
because it's been there for a long time, blood
Yes.
stagnation. Okay, so I hope that clarifies a little bit. And one more question, Dr. Chang, I have for you. When we talk about masses, any kind of extra growth, in Chinese medicine, we learn, okay, it could be a blood stagnation mass, or it could be like due to phlegm and damp, right?
Yeah.
So do you care about that, or do you usually just care about, it's cold or hot? Because you just
doesn't
break it
matter.
all
Just
away
use them
anyway.
all together. Don't think
Okay,
that much.
so that answers my question. So for you guys too. So don't worry about it's phlegm, it's predominantly blood stasis or whatever, just break it all
told
up
you.
and make sure you the temperature is correct. The herbs that you choose is either cold or hot.
The things we're talking about here is very theoretically and ideally.
Right.
Actually, the human body is very complicated.
Right.
So you can use them in both at the same time.
Right.
Okay,
So
let me answer the question.
Okay.
First one, would you recommend that we should take some cold breaker once in a while, just in case we have an injury? Yes, of course. How often and how much? How should I know that? It's your personal condition. You just use it. Second one, do you need to add some guide like a 阁下足鱼汤 or 血府中? Yes, why not? Wouldn't swallowed tissue be hot? Mostly, yes. I would have thought for swollen inflammation, we will use heartbreaker instead of COVID. Of course. Answer. Thank you. Okay. Any more questions? Okay. Is this formula for standalone? Would you add herbs for the underlying pattern to locate too? Yeah, sure. So, like I said, you can put them all together. That's what I did. Cold and hot. It happens all the time. Okay. Oh, I haven't finished yet. Okay. As for the 王不流行, this is very strong. This is you can say it's a guide. It's guide or leading ship to take all the bad stuff out of the human body from many openings, like from the urination or from the poo-poo, whatever, but it will not cause any kind of diarrhea or what. 王不流行 is mostly I use for ladies' period, which there hasn't come for quite a while, a few months, something, or for ladies, young ladies with the polycystic syndrome, and all this, or some lady just with some emotional trauma, all the period has stopped for several months. I use that 王不流行, but the reason I'm using it here is because I want to use something to guide all the dirty things out of the lady's body. I use the 王不流行 to clear it, and that's what I use it. Usually you don't really need it for example, a lump in the neck, a lump in the other places. This is for majorly for period wise. Okay. Okay. Okay, the second one is the heartbreaker. That heartbreaker, the word heart, is targeting a very inflamed condition like tonsillitis or any kind of inflammation in the head, something in the head from trauma or injury. I saw a guy with a big opening here. I told him, you have something inflammation in your head from the ear and pulse. He said, oh, you see, there's an opening here. Interesting. And for any kind of inflammation with the swollen tissues and pain anywhere. So if you're not too sure, that taking a pause, which is very jumpy, shouldn't be too difficult. So if you learn your pause, if you use your pause every day, you should understand what I'm trying to tell you. The jumpy pulse is very simple. And you can measure the patient's heartbeat rate. If it's 200, 80, 85, 100, 11, that's definitely some heat in there. So especially when the thyroid is involved. So I use this code breaker, the heart breaker, to deal with the hot condition, inflamed condition. And the reason I'm using it because this condition is very more popular than cold one, than old. Or you may say it's a new injury more popular than the old injuries. Huh? The herbs I'm using is 玄参、夏枯草 and 槐花. This is not only actually okay. Let's deal with the 槐花. 槐花 is for swollen blood vessel. The veins, like the veins on the leg, the veins in the genital area for let me go back to the okay. You see this area? The width. If it's too wide for a man, that means there's got to be some varicose veins in the genital area. And varicose veins will be like this. For ladies too. This width. Huh? Sorry. Heartbreaker. So the veins. Yeah. Now, okay. This is the swollen veins, or even something in the artery. So like an aneurysm in the head or something is something like this. So I use 槐花. So this is the same condition as the hemorrhoid inside the anus. So the swollen veins, something causing a lot of pain. Sometimes it breaks and bleed. So 槐花 is for that. So you can use that 槐花to prevent some possible stroke from the breaking of the vessel in the head. And 夏枯草, the same thing, which all the three might lower the blood pressure as well and lower the heat in the head. The fire in the head and the fire in the anus are the same thing, same condition. So I use this 玄参. The 玄参 is a cold and sour herbs, so it can shrink all the swollen tissues. 夏枯草 is the same thing for the eyes, for the head. 槐花 was originally used for hemorrhoid, but it's good also for the artery in the head. So if the patient has a lot of high blood pressure and all the fire, sometimes I tell my patient, hey, your body is like a volcano. So a lot of heat and inflammation generated from nowhere. So you can use this heartbreaker to deal with all the swollen condition hidden inside, which cause pain and inflammation, including arthritis, including rheumatoid arthritis. You can use this and my astringent at the same time, because after you shrink all the swollen tissues, you will be able to help with the pain. Otherwise, use painkiller is totally useless. Oh, let me see the questions. Baker's cyst behind the knee does not feel harder behind. Whatever, you can use them both. If there's heat, inflammation, but someone has kidney, oh, come on, forget about kidney young. Let's deal with the disease first. I will not reduce the 玄参. Can Huaihua be used for swelling? Yes. What is dose? What do you mean dosage?
Dr. Chang, can you read the question so people can hear you?
What's the dosage for this herb?
Oh, if there are no percentages, it's equal proportion, equal percentage, making it 100 grams.
How does this compare with 真人活命饮? Is good for style? 什么叫 style?
第一个是真人活命饮跟这个有什么不同？那第二个问题就是那个长眼针呐、
哦，
用这个吗？
Come on. 真人活命 is for pus inflammation. This is for swollen tissue. You can put them together. No problem.
So Dr. Chang, how do you use this? How do you choose to use this or the astringent complex for inflammation
Told you,
and swelling?
I use them together.
Together?
Yeah.
Okay. So if you guys want to ask questions, can you put it in the Q&A section so Dr. Jimmy Chang can see? Thank you.
Can you 这里问题太多，这怎么办呢？ Talking about, can you see fire in the head, on the ear? Yeah, like where the earlobe be red. Yeah, I told you in the beginning, the first ear. You didn't listen, huh?
The earlobe is the head. So if you see any redness there, yes, then
Yeah,
that's
this is
head.
the first picture we talked about earlier. Can everyone direct the question to? Okay.
And another question, if there's an infection, would you add herbal ABX?
Yeah, sure.
Yes.
Why not? Put them all together.
Yes, Dr. Chang combines a lot of formulas in his prescription. So there's never just one formula usually. This is just part of the equation. Okay,
Okay.
next formula. And if there's no other questions?
Okay, we've been talking about one, one hot one, one cold one. Let's go next. Compare. What to compare? Nothing to compare about. One is for inflammation, one is for stagnation. So if you're not so sure about the diagnosis, just put them all together. That's what I do. Can see that? Okay, let's see the circle here. What this? Inner ear, right? It's red. So there's something in the head. And also, this is also the inner ear and head. So if the patient's complaint is, I have headaches, I feel dizzy all the time, and even with a little bit of high blood pressure, you can see there's a darkness there and there's a redness there. This is the time to use both cold breaker and hot breaker. But as I mentioned earlier, the hot breaker is more for the head. So you can directly use the hot breaker, 玄参、夏枯草 and 槐花. You see this? This is the abdominal area. See the little beans there? It's dark. Then you can use my sister breaker or the cold breaker together. And this is the testicle. If the patient is suffering from any pain down there, then you just use both of them. See this, the darkness there? So I would tell my patient, hey, you had an old injury on your testicles sometimes before. But this one is definitely red. See that redness there? So must be some swollen condition, swollen tissues inside the inner ear, which will cause severe vertigo. So we must use cold breaker, hot breaker, and astringent. That will calm it down. And this is the chest, a lot of us dots. And this is the neck and shoulder, no redness, that means blood stagnation. And this one, this is supposed to be the nose. You see the little dot here? If a man has man or lady has a condition like this, that means he's losing memories. The memories goes down fast. It's not a good condition. Good. Okay, now you can see it again. What's going on? I touched this.
It's okay. You click that one, so you're gonna go back your PowerPoint.
Okay, sorry about that. Now you can see the redness there. Then you'll be able to use whatever is related, huh? Questions? What for endometriosis? We're not reached that part yet, though. That's next we'll be talking about. No hurry. Any questions about this? This is so clear. There's another one. Some inflammation. Oh, see this one? That's the head. It's in the head. There's definitely some old injury in the head area that might cause headaches too. And this is it's not very clear, but anyway. And this is neck and shoulder a little twisted. And this one is mostly this one. Oh, this is the this seems to be a lady. There's something on top of the ovary area. If this is the inflammation and abdominal area. So if the APX or other anti-inflammatory medicine is not working, then you can try my breaker. You can use cold breaker, hot breaker all together. Okay, this is not a cyst, just temporarily some kind of a tissue inflammation, and this is the head. Okay, let's get rid of it. We'll be talking about the endometriosis right away, huh? If someone has the fire in the head and they have diarrhea, we use hot breaker. Yes. What would you add formula to address the astringent combo? Of course, do that. I love the extra way of diagnosing using the ear. Does Jimmy use iPhone to take picture of ear? Not anymore. I have questions regarding ear marking. What redness on Shenmen? Oh yeah, Shenmen. Okay, this is a good question. The Olivia asked, what would redness on Shenmen indicate? 30 years ago, I was working with a bunch of people from Hong Kong with what? With laser acupuncture treatment. Laser acupuncture treatment. We use the helium, helium laser. There's red lights to shoot on some acupuncture point to get treatment. The Shenmen is one of them. We use laser beam to shoot to light up the Shenmen area to help people with insomnia, autonomical disorders, sleep, stress, anxiety, all the things like that. And we use that same laser gun to point at the Neiguan, the hot 7, pericardial 7. And we have, if next time maybe I have a chance, I still have all those pictures, photos in my office. We use the laser gun, and we have some kind of a brainwave detector. And we have the proof. After we do the Shenmen laser treatment, and the 内关, the very frustrated waves will become normal and stable. We have scientific proof of that. So Shenmen is one of the points we use with the laser gun. It's very interesting, but we don't know how to do it anymore. I even use carbohydrate laser to treat skin problem, to burn off all the marks and the moles and the rashes, whatever. So Shenmen, there's a redness in the Shenmen area, means sleeping disorder, definitely. You can sometimes by using tranquilizing herbs might not help. So you can use my cold heartbreaker to break up all the swollen tissues inside, even if it's reversible, but we believe that something definitely swollen inside, and my medicine will do the work for you. Okay? See? See the red spot? That seems to be the constipation. And this is the hip. If you use Centong Zhuyu Tang, or you use my the bone spur, flex spur, it didn't help. And this is the neck and shoulder. Use anything that didn't help with the pain, then try my breakers. Oh, it works fine. See, the neck and shoulder is red, but it's not pure red. It's dark red. So that means still blood stagnation in there. So you can use both. Oh, you see this one? The black spot in the head and neck. This definitely calls for the cold breaker. And you see, this is the lumbar. This lumbar all dark. So there's a lot of stagnation in there. Stomach is not too bad. Oh, here, stomach is here. Little stagnation, huh? And this is the prostate for men. If he's complaining about prostatitis or frequent urination or swollen prostate condition, you can use my cold breaker, okay, here. And this one is definitely calls for a hot breaker. Okay, any questions?
So Dr. Chang, last week you talked about a bunch of formulas.
Easy and interesting.
Yeah. Last
What?
week you talked about a bunch of blood moving formulas, you know, like the club combo, the circulation
we'll be
thing.
using that later.
So yeah, so when do you choose the blood moving formulas from last week, and when do you choose these hot breakers and cold breakers? They seem to be all moving blood.
Yep. Whatever
So
I like. I feel like.
What's the difference? How do we know which one to use?
Depends on your inspiration.
So how do we get that inspiration?
Learn.
What?
Learn from elotus.org.
Learn from you. I am even confused. So okay, so how about this? If a patient comes in with pain and you see a brown vein on the brown vessel on the ear, I would go to the club combo and the formulas from last week, like
Yeah,
those
why not?
ones. And if they don't work, I would use these breakers.
Yes.
Is that a better strategy? Or, because I only see dark veins. If I see swollen,
Just don't mind that. Just put them all together.
Just put them all together? Okay, so if I put them all together, what are the percentages? Like 50-50?
Yeah, equal.
Equal?
Yep.
Okay.
That's so simple. Is it like you're trying to make a dish like a cuisine? You put beef, pork, lamb together.
Well, that's the thing, last week's blood moving formulas is like beef, and this week's breakers are like lamb.
Yeah.
They're both meat, but I need to know what's the difference and how to use it.
Not
so
much.
I can use the
Just
right
put
one.
them together.
Just put them together?
Yeah.
Okay.
Low back. The question is, what is the dark line along the low back area? That's mean blood stagnation, old injury. The dark line across the back area is the last cell. When you see a doctor, it's the same thing. Okay, next one. Oh, this is the thyroid. See here, the thyroid is swollen, so it's a nodule. So this lady might have a swollen neck, like a goiter or something. You can use my cold breaker and hot breaker together to destroy that. And more than that, there's something here. See here? This is the vesicular gallbladder. If it's so dark, that means the dead blood in the dead mass. So it might not be painful or hurt or something. But if it does, then you can use my cold breaker, hot breaker altogether. And my club combo, the mighty combo. Mighty combo is a great combination for both cold and hot condition because it has zhizi. Zhizi is especially designed for swollen tissues too, but not as strong as my hot breaker. And you see here, there's somewhere above the ovary, maybe from previous operation, miscarriage, whatever. If the patient's demand is that you treat her abdominal pain, then you can use my cold breaker or my cyst combo I'm going to talk about. Ooh, see the little lump here? You might not find this on the pulse, but you can surely see it. And see the redness, just like the previous question was the red line across this hip. This is the hip area. That's inflammation. You can use my bone spur formula, or you can use my breakers. If there's a rash on the lower back area on the ear, and the patient complains of lower back pain, can we use Zhen Ren Huo Ming Yin to treat the lower back pain? Yes, but Zhen Ren Huo Ming is not strong enough. Usually I don't use it. Okay. Let's go to the next page. Oh, cyst breaker. Cyst breaker, by the name, you can tell it's a cyst breaker. It's all designed for women with the endometriosis, with the polycystic or fibroid or tumors or masses, whatever. It's all for genital area for the ladies. So I usually use this cyst breaker in the beginning of treating of infertility lady. So it doesn't matter if she has pain or not, okay? Let's do with the pause signs. For this endometriosis, the pause will be like this. The left-hand side, huh? 寸关尺. The 尺 area, you will have a very strong needle pulse, very thin and long. This is the 尺. Very thin or long. Like I said, like they're putting a acupuncture needle on the table, and when you try to press it, you can feel that the very thin, very hard body of the needle, but you cannot push the needle into the desk, into the wood, right? So that's exactly the feeling. No matter how hard you try, you just feel the very thin needle pulse in the 尺 area, left-hand side, huh? So that's the endometriosis. That pulse also means in way. Do you know my in-way pulse? 8 extra meridian in-way. That means several things. Try to remember. It means constipation, hemorrhoid, dizziness, headaches, skin allergy, and bone spur, the back pain, the discal back pain. So an in-way pulse is very, very, very thin, just like a guitar. Guitar has 6 strings, right? The last one, the thinnest, the string. You can call it a string pulse. We call it wiry or whatever. It's very, very thin, just like your acupuncture needle. So you have to use your fingertips to feel that. And it's very long, extended over the chi area. That's got to be endometriosis and all those related symptoms. Headaches, dizziness, hemorrhoid, constipation, back pain, skin allergy. I don't know why. Don't ask me why. I just know that pulse represents all those diseases. Just keep on saying to your patients. So this is the endometriosis. As for fibroid, the pulse will be totally different. The pulse will be like, also long and wiry, just like a dumai or something, but it's very thick. It's about the size of a coffee stir, like that. Not like your acupuncture needle, like a coffee stir. It's like that, and very forceful in the chi area. That's the fibroid. Okay, but I use the same thing to destroy them all. So in the beginning, when I love making babies. I made a lot of babies. When I'm dealing with the couple with an infertility problem, I always do the cleaning first, because in the previous time, God knows what they have done to their bodies. So I'm gonna clean it. I always use all those breakers and this lump combo, and then I use something. When the pulse will change very fast in a few weeks, then we start using my kidney young combo, best baby maker combo to deal with that. So for the infertility in the beginning, this is the formula I always use. Okay, any questions? Okay, no problem. Okay, let's. Okay. So the formula I'm using is 6味流气饮. That's a 16 ingredient to flow the qi, yes. And 3种溃坚汤, disperse the swelling and break the hardness decoction. And this together is for qi and xue. 折中饮 is for blood and for stopping the pain. So put them all together. This is the original design for genital area, for infertility, for that purposes, not for the problem in the thyroid, in the head, in the neck, in the shoulder, in the stomach, in the vesicular, not for that. This is especially designed for lady. Very, very good. And the pain. A lot of people, actually, this is dealing with cold condition. This severe constriction, this is severe wiry pulse means severe constriction. In other words, it's cold. So I always tell my patient, don't drink anything cold when the period comes, because they will cause more pain. So this is the sister breaker is especially designed for ladies' problem. Okay, it's not for. You can use it for prostate too, actually. And also you can add little opener. Remember last time we talked about the opener? For this tight, wiry pulse, okay? Any questions? What happens if patient wants to stomach pain treated? Just a cold blood stagnation there, but this rest of you is red. Yes, of course, use them both. So easy. I mean, it's so easy to be a doctor. Is there a limit to as how large a cyst can? Nope. I've used the patient for years. Oh, 6 inches. Oh, that's pretty big. Do you add 少腹足鱼汤 to it? Yes, I do. For infertility, for how long will the person need to take this? Yeah, I told you the pulse, the thin and the wiry pulse might change in a week or 2 or 3 weeks. That's top. Then we use tonifying the best baby maker or the kidney young combo. Okay. Maybe in the future we'll have several classes. We'll be talking about how to tonify the kidney young. I have a lot of new inventions about tonifying kidney young. And a lot of new understandings. There's an old doctor. He's when I was in Taiwan, he has a very magical way to narrow down any kind of a disorder into kidney yang deficiency. So he always gives those kidney yang tonifying agent to treat many different, even for cold, for cough. He is a genius. But anyway, tonifying kidney yang can be very useful in a certain way. Okay, so the chat. Please tell us questions you are answering. I did.
No, he means that when you are
Okay.
answering question, can you read the question out loud so everybody can? Not everybody can see the Q&A, Dr. Chang. You can see the Q&A. Not everybody can see the Q&A, so people don't know what you're answering. So that question was, how long do you take the cyst breaker for cleaning up purposes? Until the pulse changes, or just for a week or a month, or how long?
How should I know? The different people.
Right, so it depends on the pulse, right? If it doesn't feel inflamed anymore, doesn't feel like there's the in-chiao pulse or the endometriosis pulse or the fibroid pulse, thick pulse, then you stop, right? You go to tonify, right?
Yeah. Different people, different body type. From ladies will need different length of treatment. For big, choppy ladies, you need a little longer. Okay. Okay, let's get down to the next page. If you want to take a break, Tina, you want to say something?
Okay, we can take a break. Let's take a 5 minutes break, okay?
But I'm going to keep on talking. No time to stop.
You don't want to go to the bathroom? No break for people? Okay, everybody stay then. We'll stay. No break.
Can I pause a second?
Sam wanted me to stop. Okay. What?
You want to continue?
I'll continue. Okay, well, let's go on. The number 4 is the lump combo. Okay. For all unknown lumps, masses in the breast, thyroid, anywhere in the body. This is the combination of cyst breaker and resolve lower plus mighty combo. The resolve lower is just kind of like the same thing. I actually think the same thing. I believe that this is the same thing. You can put them all together with mighty combo. We talk about the last class. So to put this and this together, that's a very, very strong bulldozer. Will clear all the things, including cancers and all the stuff. I use it quite a bit. 乳香没药 is for pain. 三人儿足, this is the mighty combo, and 栀子 for inflammation and swelling tissues too. So you can put them all together, like in the lumps, masses in the breast, thyroid, or anywhere in the body. For the breast, you know where to find the signs. You do not find you cannot see it in the in the pulse, over the pulse, is on the ear size. The breast cancer will have a very unique size. That one ear is red, the other ear is black. One red spot in the lump in the breast area, one dark black spot on the